So we're looking at the pelvis. The client is supine. And we're going right to the pelvis. Here are the ASISs, the anterior superior iliac spines. We're resting our hands over the sides of the iliac crest. And around mid-crest, we're just going to let our fingers, usually third fingers, kind of drop right on the edge. I'm not inside. I'm right on the edge. And that's a good point.
Much more tender here than there.
Yep. Now, what I felt was the distortion that this side was finding its way to midline cleanly. This side was still kind of smeared up between the tent and the pelvis with the innominate kind of sitting out in space, which said, well, there's probably some innominate points. So this one, and if I really dug around and worked, I could probably find a really good spot. Now, if this point represents that the top of the pelvis shearing into the top of the sacrum, and we want to exaggerate that distortion, what might we do?
Press it in.
No, lift the leg.
That's oppositional, isn't it? Right? Think about the shape of the distortion. Okay, we lift the leg. But that would
Internally rotate.
No, well,
Yeah, bring it out.
hold on. I've got my point. Okay?
Yeah.
If we want to get this going in,
You want to get that going in?
what do we do with the leg?
Internally rotate.
Internally rotate?
No, bring it out. Bring it, bring it out.
I mean,
Bend it.
AB duct?
AB duct, just bring it out. Okay.
AB duct?
Can
Look
you-
at that. It's softening in there. Oh my goodness.
Have you ever been?
How's that feeling? No.
Never been like that.
No. How can I generate leverage in the pelvis as well at
No,
that level?
if
I
you're,
bend
if
like-
you're using a lever arm up there as well. Doesn't
Why would I want to fight with the bent leg flopping around if I can just hold the ankle and do
Because
this?
your force is going into.
Yeah, the forces are streamlined. This is exactly, very well done. This is exactly, and does that hurt there?
no.
Yeah. And what this is actually doing, again, I'm using her leg as a lever to generate a force to turn her innominate clockwise, thus exaggerating the strain and adding a little compression at the upper part of the sacroiliac joint. See where it's going. See the big picture. Okay? High flare in. Okay? Sometimes,
That's a nice pop.
that was my shoulder.
He's a ventriloquist.
Yeah, really. Sometimes the adductor mass inner thigh tension is so great
Which it is tense.
that you can't get them to where. Now, can you all appreciate that when she was here, luminously, her leg was out here? Right? Maybe not. The tender point's there, whether your sight, your perception supports that. But what I do, if I can't get this leg open enough, moving my little pack, rest her leg on my hip, and then take her out to where I can, and now push into me,
Okay.
monitoring the point still. And then release, dear. Keeping the leg, do I want to roll the leg out? No. So in this case, I'm going to keep turning her in. Just so, push in again to me. That's good.
Yeah, that
And
feels
relax.
a lot better.
And then sometimes, I'll hold this leg and do push both legs together, please.
Brilliant.
Relax. Ooh, that really opened up everything. There. Good. Is this interchangeable with the changes we support when we do the iliosacral lift?
Is it interchangeable?
They can get the same results.
Not exactly. No.
No.
Emphatically no. There are a lot of people who believe that you never need to treat people standing up, that you can do everything on the table that needs to be done. And that just ain't so.
Only if a person never stands up.
That's good. Yeah. Right in the middle of the symphysis pubis, on the top, there are two arms called rami, of the symphysis pubis, the superior ramus and the inferior ramus, right? We're on the top of the superior ramus, about right at mid-pole, and we're just going to curl our finger and push right in. And it's also a horrible sacroiliac point. This is coming from the lower pole of the sacrum. So Joan's name is this, and I keep the same nomenclature. Find my
You said the
noir.
ramus, right? The lower
Yeah.
ramus?
Superior and inferior ramus, so it runs superior. Superior
ramus?
ramus.
Where?
Midpoint, up top of where it goes around. These curl
So what's the
around.
superior ramus?
The top ramus, the pelvic, this.
The pubic bone. Now remember our 3 pie pieces, right? Catherine.
I knew.
I realized this moment was about to pass, and I needed to take advantage of it. So there's the ilium. That's this big thing on the side, whose pie piece comes down into the hip socket. Okay. We have the ischium, which is the back column, which is knob underneath, which is the thing we put our hand on when we're doing the IS lift, right? And we have the pubis. So we have the ilium coming in from the side, the ischium coming in from the bottom, and the pubis coming in from the top in medial, right? So this whole region of the pelvis is called the pubis. And as an adult, we've got 2 large bones. The 2 little arms, you've got the superior and the inferior, okay? And so we're on the top bone, the one that's... So I find the pubic ramus, superior ramus, by going on the belly where I know it's soft and I'm safe. I have a couple of patients whose superior ramus is kind of up here.
Wow.
So if I go where I think it is, I'm about to do an internal pelvic exam. Fortunately, the woman is like 75 and she thinks it's really amusing. Dr. Weiss, they're doing that again. So I start on the belly, soft part of the belly, with a broad contact with my fingers, and I just slide down. And there's the bone. My bone's right there. I cannot make a mistake. If I start up by the umbilicus, then I can come right down from the umbilicus, from the navel, and find the point. It's easy at that point. And then from there, I sort of can eyeball. Here's the symphysis pubis. Here's the large ilium, and I go midpoint, and I find the point. It's still tender, ain't it? How come it didn't get better all by itself? So, if the high flare in leverage was to create a clockwise vector, thus dealing with the superior pole or the upper area of the sacrum. Now we want to generate a force, do we not? That's going to go anti-clockwise, counterclockwise. That's going to address the lower pole of the sacroiliac joint. Now, the original way Jones taught this, which I never really liked much, is bring that leg up. So foot in around your knee, and then monitoring the point, he would just drop the leg out like that. Since the hip is anterior, what we're doing is pulling the pelvis around and down, and he would take this down. But most people don't have hips that try that with me. That won't work, and the force really never felt localized. Doesn't look right, does it?
And does that
Because I
hitting
feel
the
like it's
point
kind of,
really?
no, and the point's still really sore, right?
Better, but not.
Yeah, exactly. So what about if we brought the leg up, bent the knee, brought the leg up about 90 degrees, I slip my hand through, slip this hand, so I'm monitoring with this hand, right? Slip myself here, and what about if I generated a strong internal rotation force, thus compressing? How'd that?
Well, that point's definitely gone.
That's an internal?
I'm externally rotating, well, what am I internally rotating, right? I'm externally rotating the thigh, I'm internally rotating the pelvis. I'm generating a counterclockwise vector into the lower pole of the sacrum by externally rotating the thigh. And using her leg as a lever. Yeah. So where her heel's going is actually where the final force is being generated. So it's really important to rest your forearm on her knee. That's your fulcrum around which the rotation is occurring. All right? What am I doing? I'm bringing the leg up to 90 degrees or so. I'm slipping my hand through. I'm monitoring with my up hand. And then dropping my forearm on her knee for a fulcrum, I'm cranking her around. Okay? So we've dealt with the upper pole and the lower pole of the sacrum, have we not? There's only one other point that I find really useful in pelvic trauma and SI stuff. That's an anterior point. And I'm not sure where it's coming from. Joan showed me the position. It's like, how did you figure that out? And you'll see. I mean, you've seen me do this, those who hang out. So just above the pubic bone, the spiramus, is a ligament that runs along the pelvis called the inguinal ligament. Or if you're from the south, it's the inguinal ligament.
Not for me.
So at the same level, I'm up like an inch, and I'm going into the pelvis, and there's like a little violin string, little steel string right there
At the same level.
at the same level. That's a nasty kind of tenderness, isn't it?
Same
Yeah.
level
Pubis,
of
right?
the mid-level.
Yeah, it's the same level as the last point we did.
Okay.
Okay.
Just a
Right.
little bit,
I'm up and in, and there's the point.
yeah.
Now, bring this leg up. And what I do is cross this leg over all the way at the knee. Push, 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 push. And I
Oh, this is
reach
so cool.
through and I bring this up. See, this is the way Jones taught it. I actually prefer doing it this way,
Oh, like this.
crossing
yeah.
this, reaching through, grasping the leg. So I've done this own variation. You won't find this in the book.
Eagle posture.
Let that go.
Oh.
Yeah, like eagle pose. Right?
Nice.
Yeah.
It's
is
a
it-
little more comfortable, nothing.
gone.
Nothing.
So I'm putting this position, this
And you have your hand on
force
the-
here. The
the
hand on the
ankle.
ankle is the key, right? So there are two things that are really crucial. I brought her to 90 degrees. It looks, rest that leg on me completely. That's it.
Right. it's
Yeah,
short.
that's it.
Sorry
So
about that.
the position of her leg on my forearm looks like she's just resting. It's actually a fulcrum, right? And I'm pulling her foot around that fulcrum as I'm using that to turn her whole pelvis. It's a really nice.
Well, and that's
So you're using force down, back, towards you.
pushing the whole pelvis up, and that's actually releasing some of the top back of the pelvis.
Yep.
too.
Well, yeah, we're using everything as a lever to get backward.
Yep.
So if you look on an anterior posterior axis, watch, I'm rotating her pelvis. Right? In addition to that, this hand, the hand on the right leg crossed over the left leg by bringing her her ankle back away around the fulcrum that her left thigh is creating. Look at the rotation I'm creating in her hip capsule itself. Right?
So it's a.
I'm not sure my leg will let you,
both here and
let you do this. We could try it though.
Which way?
So let me just recreate
You're
this
going that
again. So the side that where the point is, first of all, how's that feeling?
Much
It's gone,
better.
right?
I'm not
Yeah,
like, ugh.
it's very cool. Come up.
Okay.
So the side, you're going to put that side on the foot resting. So step one. Step two, you're going to cross the other leg. Is that right?
No.
No, it's the other way around. Thank you.
Okay.
So you're going the other side,
Bend other side.
right? You're going to take the affected side where the point is and totally cross it girl style, right? You're crossing knee to knee, right? You're going to reach under the left calf. You're going to grab the ankle of the affected side of that right side, and then hopefully resting their popliteal space on your forearm. You're going to bring the whole system up 90 degrees first. And then by fixing my forearm and her left knee, I'm going to turn her right ankle around me
Pull it.
using my body. Watch my belly. I'm pulling away.
Yeah.
And it's just, it's creating this really beautiful combination of vectors.
And it feels really good, actually.
Yeah.
I could never get there by myself.
It's like, who figured this out?
So you're pulling towards the point.